Hey, Dr. Swainey, what's the difference between addiction and dependency?
Good question. I think there's a little confusion in the public about the difference between the two, or even if there's a dependence, or even if there's a difference between the two. I can tell you in my oncology practice, I used opiates a lot. Obviously, cancer can cause pain, so I put people on opiates to help with cancer pain, especially at the end of life. But one of the most common things I saw was people, I would say, hey, I think we need to do some pain medicine, some of the strong stuff, some opiates, and they would automatically brush back and say, I can't take that. I don't want to be addicted to it. Or no, I'm not going to take that. It'll cause me to be addicted to it. And when I would talk to them further, what they meant was dependent. They didn't want to become dependent on it. And dependence is when you take something and if you stop it, you go through a withdrawal syndrome, withdrawal symptoms. And the withdrawal symptoms can be dependent on whatever it is that people are taking. Addiction, on the other hand, is addiction can involve dependence, and usually it does involve dependence, but it doesn't have to. Addiction is more related to our relationship to drug or substance that we're using. It's more related to effects of the drug and the substance on your life. And are you taking the drug or substance because in spite of bad things happening in your life? Are you using more and more and more of the drug to get the same effect? So addiction involves a lot more than just dependence. Addiction doesn't have to have dependence, but most of the time it does. Dependence is just dependence. Dependence is symptoms after abruptly stopping a medication. The dependence just means that you have to wean people off medications to avoid the withdrawal symptoms associated with the drug. People are not automatically addicts if they are dependent on a medication.